Namaste, Sat Sri Akal, Sawadee Khap, Salam Alaikum. Welcome to Indian Association of Thailand, IAT. This segment, we have a special segment that's called Talk to Medical Expert. As all of you aware of this thing that, okay, COVID is disturbing everybody's life, and we are getting lots of telephone calls for help. To extend help, whatever we can do, we are doing. Lots of Indian community also doing. I really appreciate from various communities, they are helping in their different way. But still, help is not enough. We thought of coming online. This is our second episode. First episode was released 2 days back, and it was overwhelming. Many people got lots of information. So we got a request that please go ahead and call some different experts to come online. We have Indian doctor. We will like to request Thai doctors, Farang, anybody who wants to come and help the community. We welcome them, and we'll do this kind of episode. Indian Association of Thailand, their main purpose is to help the community. We join together, help hand in a hand in difficult times as well as in social work also. I'd like to call our IAT Youth Chairperson, Nikon Sastave on screen. Nikon.
Sat Sri Akal ji, good evening.
Good evening, Ji.
How's everyone doing? How are you?
Good.
How are you, Mr. Chuan?
Good. Going on, but still time is, the tense. Whole time phones are ringing. At present, I just put on silent. Otherwise, it's ringing, and every minute people, they want some help on this thing. So how about you?
So at the moment,
you also
the phone has been ringing off the hook. And as everyone knows in our community right now, more and more people from the Indian community are getting infected. And we all are trying our best, coordinating with all the different communities to try to find help for them. But at the beginning, what we can do or what we are doing is, if anyone needs help in getting some basic medication sent to them, we can do that. Not not the COVID one, but basic like cough medicine or the herbal medicine, Fathalaichon. We can send those to them. That's what we are doing at the moment.
Nikon, let's welcome Renuji also. She's a ladies forum chairperson for chairwoman for ladies forum. Let's welcome her on a screen too. Renuji, namaste.
Swadee Kha, Namaste Ji. Hello to all.
Yeah. Okay, Nikon, go ahead. We're talking.
So, Pan, what we were just talking is that, our Indian community at the moment, many people are infected, and some people, the full family is infected, so they can't get help being sent to them. We are looking for beds for them, but it's not easy. The medical system in Thailand right now is completely overwhelmed, and all hospitals and hospital beds are full. So we are doing our best. But meantime, I know, Pan, you've been helping send food to a few houses. Can you please tell us a little more about that?
Yes, we've been receiving a lot of requests, especially as you well said, for the beds, first thing. And then, of course, comes from people who are in home isolation. Those people, of course, they are not in the position to be cooking. So we, together with other helplines as well, have been organizing food, especially in 71 areas, so Sukhumvit 71, Onut area, Bangna area. There are a lot of Indian expatriates that side. And it's sad. I mean, there are people who have got young children, 5 years old, 10 years old, and some of them got in-laws with them. All of them have been infected. So home isolation So we are trying our best, and we will continue to do whatever possible to reach out to us. And yeah, just take care, keep safe at the moment. What I can say to everybody, try, I mean, not to go out, and need any help. There are various helpline groups. Reach out to us, and we'll do our best possible.
All right, Renuji, Nikonji, we have a special guest today. We have Dr. Harjit Singh Bhatia, or Harry. He's with us now. Let's welcome him. But before going welcome, so let's put a one slideshow. Let's welcome Dr. Harry on the screen. Dr. Harry, namaste, sat sri
Sat Sri
akal.
Akal ji, Namaste, and hello everyone. Uh, First of all, I would like to thank IAT for the opportunity today, for giving me the opportunity to come here and share my views, my talk, and my idea on the current situation of COVID-19, what's happening and what is not happening at this moment. I am not infectious disease doctor. I'm an orthopedic surgeon, and I'm working in a government hospital. In the past 1 year, we have not been doing any surgery, orthopedic surgery, because of this situation. So it's very difficult time for everybody, I know, and for us and for the public as well. And public are very stressed, confused, and depressed, and they have a lot of questions regarding COVID-19 and need a lot of help. And it's very good that what Indian Association of Thailand is doing at this moment, helping people other than what medical or doctors are doing.
All right, Doctor, can you tell us about this pandemic, how to cope up with the present situation? As you know, Thailand is going through very difficult time. Many Indians, especially, they don't know where to go, what to seek advices. They're going from hospital to hospital, looking for beds, looking for right doctors. Most hospitals they don't accept them, not because Indian. It's because they don't have beds. I know there are some reasons. So can you talk on this one a little further?
At this time, we can what I can say is we classify the patients into three types: green, yellow, and red. Now, green is are the patients, they are asymptomatic or less, or have very, very less symptoms. The second is yellow, they have some symptoms. And the third one is red. Red is they have severe pneumonia. So as you say that there are a lot of patients and hospital beds are all full. So at the current situation, what hospital is accepting is the patients who have severe medical conditions like in a pneumonia or infection to the uh, multi-organ system. So these kind of patients are admitted in the hospital, and the yellow or asymptomatic, mild symptoms or asymptomatic patients are now sent to the community isolation and home isolation at this area. So yes, it's difficult time to find beds, especially in the hospital, as you know that it's been overloaded. Every day there are over 10,000 cases. Like today, it's 15,000 cases, newly infected cases. So it's really very difficult to get into the hospital. I do agree that. So to first first of all, we need to test whether it's the patient is you are positive or not, COVID positive or not. And if you are COVID positive, then only you can enter into the system, medical system for the treatment. To get a COVID test positive, you can do rapid antigen test at home. And if it is positive, then you have to go to the hospital to get a PCR test to confirm that. Then only you can get the further treatment.
Okay,
All right.
doctor, what is the difference between antigen and antibody test? They look very similar. Many people are confused on that one.
Uh, Antibody is something that our body produces. When we get infected, our body produces antibody to fight with the germs. And the antibody test is a test that catches the antibody that is being produced after being infected with COVID-19. An antigen is something, it's like a foreign body that is coming into your body, and you are catching that. In case of COVID-19, it's some part of the COVID-19 we are catching that one. But to be frank, these are the screening tests. It's not the confirmation test. Okay, if you are doing antigen and antibody test, it's just a screening test, because there is a uh, what can I say? The sensitivity and specificity is not that high as compared to doing a PCR test. Like some of the kits which they are using, they have a specificity at around 80%, some have 90%. So the one which the government is using at this moment, antigen test kits, and now they are saying that it's around 90% accurate. If it's positive, that means you are having COVID 90%, 90 cases in 100 cases. So 10 cases might not. So you need to be sure that you have COVID-19 by doing PCR before getting treatment, or go to the community isolation or home isolation.
Okay, now when somebody feels that they got a COVID or something, to test that antigen test, right?
And
Not
yes,
antibody.
I will
In
say
the
a screening test and a confirmation test. I will say that. And in the screening test, there is antigen test, there is antibody test. So what we are using now, we are using antigen test. It's more accurate. That's why.
okay, because in
It's
the
just
market,
a screening test.
yeah, in the market, both are sold whenever we ask for it, and they just supply. Okay, antigen, antibody. So many people they keep calling, hey, which test should I do? So first, it has to be antigen or antibody in the initial
At,
stage.
okay, at this moment, government has approved antigen test kit only at this
Okay,
moment, and it's being supplied by the government. You cannot order. It's not that you cannot. You can order online, but the online stuff is not approved yet. I will say that. So you have to go to the pharmacy shop to get it, or you have to go to Zoon Satharana Sukh to get it, or you can go to the hospital to get it tested with antigen kits. And now there are many groups or many people that are doing tests in the community. They go and do tests over there. They are using antigen test, that is a screening test. So when the
Okay.
patient is positive over there, then they will refer those cases to the hospital for
Mhm.
confirmation test by PCR.
Okay, Nikon, now you have any question for the doctor? Yes, you can go ahead.
Actually, uh, doctor, as you are, one of your main specialties is also sports medicine.
Oh yes,
People
I
have
forgot
been,
to tell in the beginning.
yeah, people have been asking that if, how can, I'm home now, I cannot go out, the parks are closed, all the exercise, the gyms are closed. Is there anything I can do at home to build up my immunity? Any sports? And do you recommend like breathing exercises or yoga? What do you recommend, doctor?
So actually, what I think is exercise is necessary, because what we do now is we are not moving around, we are staying at home. In normal days, we walk, we go to work, we do a lot of activities without knowing it. But now we are in the house all the time or most of the time, and sitting on the phone, sitting playing phone or on the computer. So our body lack flexibility, lack the agility and strength. So what I recommend is you can do some simple exercise, stretching exercise. If you have treadmill at home, you can use treadmill. If you have trainer, any kind of trainer, cycle trainer, you can use that. And if you want to jog or run outdoor, what I suggest is you have to run or do exercise on your own, not in a group of people. That is not safe at this moment. That's And you can do yoga. Yeah, yoga is a good thing, and some people, they are doing online as well. They have teachers that they teach yoga online, and you can do some weight training. This will help in your muscle and flexibility as well. And another thing I would like to say is, other than the body health, there are mental health and emotional health as well that we are concerned, because we all are in the house, and in the closed doors, listening to the news and all these things, it makes us stress. So these also affect our daily health, daily life and health as well. What I recommend is try to shut down the TV, the news, and talk to each other. That will help. And have a good talk with your friends on the phone. That will reduce stress as well.
All
Okay,
right. And sorry, um, Pan, Mr. Chuan, back to you actually, if you have a
yeah.
question first.
No, I want to
I
ask
would like
Renu
to
if you have some question.
to what Dr. Harry said in terms of exercise and what Nikon, he's the head of the for example our IAT runners group. So definitely there are more exercise one can do at home, which I can recommend, as a lot of ladies also are doing. There are a lot of dance online in terms of be it Bollywood, Bhangra, Western. So many people have practiced that and they're doing, and those who are not, I would highly recommend half an hour a day. That really helps. You can do together as a family. This is the time you have to find activities that you can do, with your children, your seniors at home. Get them, just do something that would engage and keep yourself busy, and do watch some news, but also add these activities to the daily routine.
Perfect.
I have a question, Dr. Harry. There are many people, like, you are right now in the front line battling against the pandemic, right? There are some people who still think that COVID-19 is a bit overrated, right? Although the numbers are increasing here, like, look, today we have like 15,000. So there is a small group of people who feel it's overrated, and there are some another group of people who are yet reluctant to get themselves vaccinated. They feel it's some kind of chemical will harm the DNA, or so what is your message for those group of people?
Okay, so I would not say that it's underrated or overrated. It's from my experience, my daily life, I used to do a lot of surgeries. Uh, and last since last year, all my elective shoulder and knee surgeries has been postponed or cancelled because of this pandemic. What it did to us is it has taken our medical supplies, and it has made us uh, doing jobs that we haven't done that before. So now we, some of the doctors are eye specialists, some of the doctors are gynecologists, and me myself is an orthopedic specialized in sports medicine, doing shoulder and knee surgery, and we have to stop everything. We all have to do the work for COVID-19, and we are doing a lot. Uh, There are a lot of patients coming at this moment to get treated, get checked, and it's a difficult time. So, talking about the vaccination, whether to get or not to get, it's your own choice. But in my opinion, you see, there are people who are at risk. At people who are at risk are the people who is over 60 years of age, who has underlying medical conditions like diabetes, heart problem, you know, having kidney problem, who is on dialysis. These kind of people have low immunity, and they are at high risk people. I suggest them to get vaccination, because if you don't get it, there is a high chances of getting infected, and the death rate is around 2% at this moment, 1.6 to 2%. That is 100 people get infected, 2 people will die at this moment if we can treat them in certain amount. But if the patient is more and more infected and medical system cannot provide them a good care, then the death rate is going to go higher and higher. So the person who are at risk, I suggest get the vaccination. And the problem of the vaccination, as you say, that there are some complications. Yes, there are, but it's very, very low death rate. That is 1 in 10,000, as they have reported. And most of the problems can be treated. And all the vaccines are in phase 3 trial and is approved by WHO as an emergency vaccine. That is, we don't know what is the 10 years effect from now of the vaccine. I cannot tell you that whether it's going to damage your DNA or not. I cannot tell that. Whether it's going to harm you in future, we cannot tell that. But what I can tell you that if you don't get vaccine today and you are in high risk group, or you go to high risk places, or you have got infection, the death rate is around 2%, and it can go higher and higher depending on the medical facilities that you get. Now, some patients, they die on the road, some patients, they die at home. So we don't know that how many more they are going to die if they don't get vaccines. For the people who are not at high risk, like, okay, you are young age, you are fit, and you are not going out anywhere, you are staying at home. Yes, it's your choice to wait for the good vaccine or the vaccine that you don't want, and wait until the appropriate time comes that you have herd immunity and you are safe. And I don't know when it is. It's going to take a long time to be having a herd immunity in Thailand. So there's a high risk for not
Better
having
to
a
take what
vaccine.
is available. Yeah.
Yeah.
Yeah,
A follow up was just now we touched on the topic of sports. Someone
Sure.
asked, how many minutes is it good? How many minutes should we do some moderate exercises at home in order to keep healthy for during these times?
Okay. So the cutoff time is 15 minutes. Okay. So before 15 minutes, if you do exercise, you are not burning fat. Okay, you are just burning the 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 glycogen or whatsoever it is, glucose, you can say, a glycogen in your body that you have stored. It's going to be using that. And after 15 minutes, your body will start using other sources of uh, uh, fuel to get uh, to get glucose or glycogen that is being produced by other places. So you will reduce body weight, you will gain more cardiovascular strength. Your heart will pump better, your lungs will breathe better after 15 minutes of moderate exercise. Usually, I will suggest around 30 to 45 minutes a day is a good start. It's a good start, and you can continue and up to your fitness level. I will say that different person have different fitness level, but if you are beginner, you start 15 minutes for 2-3 days first, and if you see that you are okay, you can increase your time to 30 to 45 minutes per day. It's a good time.
All right. Somebody asked me,
All right.
doctor, that he's a person is 64-year-old and very healthy. He plays sports, run around every day. He got vaccinated, and after getting vaccination, he got back pain, knee pain. All the pains have started.
Okay.
So, so what he should do?
First of all, the I will say, can I say the name of the vaccine? Am I?
AstraZeneca.
Yeah, that's what I was going to say. AstraZeneca will have muscle pain uh, more than uh, Sinovac or the other groups, as has been reported. And some patients now, as I see, there are specific shoulder pain when on the side that they got injected, the vaccine got vaccinated, they have more pain on that side, on the shoulder. But as you are asking me that whether it is related to the vaccine, if it is in 1 week, it can be. But if it's more than 1 week, I don't think so. It's related to getting a vaccine, the knee pain and shoulder pain or back pain. Need to go and get it checked whether it's from something else. Maybe it's coincidence with other problem.
All right. There is another question. So they are sending through WhatsApp, which I prefer
Yeah,
people to put on a
Okay,
Facebook, so that
exactly.
we can
I
all we
would
can
like
do.
to add one more point from the
Yeah.
question that uh, Panikon asked me about the exercise. I would suggest not only you do running or moderate exercise, you need to do stretching exercise as well. Other than doing running, jogging, your body need flexibility as well. And the third thing that you need to do is some muscle strengthening exercise like light weightlifting that will help other than do running, jogging, or cycling, for half an hour to 45 minutes. Add some stretching exercise and muscle strengthening exercise.
All right. Thank you. Hey, can it be split during the day? Our President Saab is asking, but he's writing on WhatsApp also. He's
Yeah.
not
He's
Okay.
asking on Facebook.
You see, when you do different kind of exercises, you are using different kind of muscles in your body. That is a good thing. If outdoor, I will give example of running and swimming and cycling. All these three sports use different kind of muscles in your body. So if you are doing same kind of exercises every day or at the morning, evening, it's not good. You need to shift to different type of muscles. Like today, if you are doing lightweight training, you can do upper body strength. And in the evening, if you want, you can shift to lower body, and like thigh, quadricep muscles, hamstring muscles, hamstring group, gastrocnemius groups. All this you can split and you can do it. It will help a lot.
Okay.
all right. There's a question from Aruni Baga. What about yoga?
Yeah, yoga
She
is
has
good. Yeah, yoga is what can I say? It helps in strengthening your body by balancing. It helps in strengthening your core muscles. You know, yoga helps in strengthening your core muscles and increases your flexibility in your body. You know, and the most important of yoga is it's make your mind in peace, and emotions you can control it well if you do all these things. You know, it's a kind of things that is recommended by many people during this time.
Okay, what are any particular food to be consumed during this time, because less body exercises are going on? So, what do you suggest on a on dietary thing?
First of all, I would like to say to cut out the food after the dinner. You know, we all say stay at home, and the late night we stay, the more we eat. So that's the food after the dinner should be cut off to have a proper meal, morning, afternoon, evening, have a proper meal. You know, if you want, we are Indians, we drink tea in the evening. Yeah, that can be, but with some snacks, it's okay, but not a heavy snacks. That is not good. And food should be carbohydrate, fat, protein, you know, minerals, vitamin that we are taking every day. That's essential. And there is no other food that I will recommend that that says that it's going to help in killing the virus. If there's, I don't have any idea about that. But vitamins, yes, you can have vitamin C. There is a paper, or there is a research that have proof that it increases your immunity. Zinc, vitamin C, you know, and uh, it's not coming in my mind. It's in a Centrum Plus. You can have all those things. It helps, you know. Yeah, with proper exercise, good food, cut the late night foods, drink a lot of water. This will help.
All right, doctor, there's a question here. For someone who has got the COVID, has not currently taken any vaccine, what is the recommended wait time to then to
Then
take the
take the
vaccine?
vaccine.
Okay, so it is recommended for the patient who have been infected by COVID-19. Yes, it's recommended, and usually we suggest after 3 months.
Okay,
After
there is
3 months.
another.
And one more thing is, if on the same topic, doctor,
Yeah.
if a person has taken two Sinovacs and they want to get a booster of Moderna or Pfizer, how long should they wait before getting a booster?
This is a big topic. Okay, I'll talk about it. Uh, Now, what happens is there is a variant strain, Delta variant strain, as we all know. It's Sinovac is not helping that much. Okay, there are researches already coming out. You know, it's been proven that patients who have got vaccinated Sinovac, they need a third booster dose. Okay, you can have AstraZeneca, you can have Moderna, you can have Pfizer. And Moderna and Pfizer at this moment is not available in Thailand, and I am not sure when it's going to come. And if you can get it, or if you have a queue to get uh, AstraZeneca, I highly recommend you to get it, because there is a paper by a Thai doctor from Chulalongkorn. They have shown that after getting two Sinovac and the third booster dose of AstraZeneca, they have a high immunity for Delta variant as well.
All right. Doctor,
So
the
Okay.
thing
about
is that,
Moderna and Pfizer, uh, I cannot comment on that at this moment, because it is not available in our country. But if you are at low risk person, like I said, you are not older than 60 years, and you are not going into the community places like supermarket, or the market at nearby your house, or you don't have to go to the factory, you don't have to go to a lot of places. You want to wait, yes, it's okay. You can wait for Pfizer, or you can wait for Moderna, because it has been proven that mRNA vaccines, this one, Pfizer and Moderna are mRNA, vaccine, they are more efficient as compared to AstraZeneca and Sinovac for Delta variant.
Okay, doctor, I have one more question. Those who already got COVID, sick by COVID, and they got
Yeah.
better, they are back in a home. But many people, they are still scared that, okay, this person got COVID and this thing. Like I'm in a condominium. There are few people got COVID and they got better and come back to building. And
Okay.
there are certain neighbors, they scare of that one. So I want to know on
Okay.
this one, so are they totally relieved or they are still dangerous for community?
You see, not only you are scared, we are also scared. I will give you that example. I have a patient who had a hip fracture. She came to the hospital because she had a hip fracture, and we need to do the surgery. Before doing any surgery, we have to do a PCR test for COVID-19. And unfortunately for her, she was positive. And we have to wait for at least 14 days. And then we swab again, and we have to wait for another 5 days. That is around 20 days before her immunity is back and the virus in her body is very, very less, or there is no virus that other people can get infected. Now, then only we do surgery after that. So in my actually what they recommend is when you get treatment for COVID-19, it's 14 days. And after 14 days, you need to quarantine yourself in your house another 14 days. After
Okay.
that, you are virus free. That is confident. Okay.
Hmm.
But in my case, it was around 20 days that my patient was virus free. And I was able to operate on that patient after 20 days of COVID-19. That we have proved it because we have to swab 2-3 times before we can take her to the surgery. Okay, so I will summarize your question that you need at least 28 days to be able to go out and to talk to other people freely, in the sense that yeah, I am not infected anymore. Okay.
Means after releasing from the hospital, right?
Yes, 14 days in the hospital and 14 days is home quarantine.
14 days home
That is
quarantine.
that is the recommendation.
Okay, doctor, there's a one last question. I got it here. Now many people are talking about the black fungus, which is highly affected in India, which has come to Thailand. So now I want to know, there's a more fear about black fungus. They
Yeah.
said, okay, I think much like India.
Okay.
So
So we have to understand the Indian healthcare system and COVID-19 problem first. What happened in India was their healthcare system was, you know, rock bottom, and a lot of patients were there. Some patients couldn't get medicine, and what they have is a steroid in their hands, and they have some, I will not say misused, they have overused the steroids to treat COVID-19. Okay, and when you treat steroids, your body immunity goes down, and then at that time other infection happens, by bacterial infections or fungal infections happen. So now we talk about Thailand. In Thailand, we don't use the steroid that much at this moment, but we are using it in the patients who have lung infection and lung inflammation, I will say that, who have COVID-19 and have lung infection and inflammation in the lungs. They use steroid to treat and to suppress the inflammation in the lungs. So what happens is, if there is a lot of steroids, it can cause the infection. But at this moment, into my knowledge, there is no cases yet at this moment in Thailand. Okay. So what is black fungus? Now I'll tell you what is black fungus. Black fungus is caused by mucormycosis. It's a kind of fungus that is in the soil, in the air. So when we breathe, it goes into our nose. So when our body immunity is down, when you are on steroids, when your immunity is down, you have infection or you have cancer, you are on the cancer drugs, your immunity is down. So this fungus, it will grow in your nose, in your sinus. And when it grows, it destroys the structure inside, and it can destroy your eyesight, and it can goes into the brain. And the mortality rate, death rate is quite high. So we all are scared of that one as well. So we are trying to use the steroid as less as possible, especially in the in asymptomatic cases. We don't give it. Now, mild symptoms also we don't give it. Now we give only in the cases that have severe lung infection and severe lung inflammation. Then only we give in those kind of cases. So that's the point.
And Renu,
All
can you
right.
please ask the next question that was put on the screen just now?
Um, some are asking what medicines, I mean, they need to stop before vaccination days, like 1, 2 days before. What medicines? Uh-huh.
Okay, there are some, to my knowledge, there are some anti-inflammatory medicines. Okay, uh, blood uh, thickening medicines. This one you have to stop. Okay, and there are the list, but I don't remember at this moment. I think we have to search for that, for the exact name of the medicine. Medicine and anti-inflammatory medicines are for painkillers. This one you need to stop 7 days before getting the injection, or I think you need to consult your personal doctor before you go for the injection. Okay,
Right.
Vaccine.
that I will suggest that.
There's a myth, or is there any study that says that the virus will stay in the body for 50 days after you are infected? Like if after 40, 30 days or something, I go and take the test again, will it show positive, or will the virus leave the body and my test will become normal again?
Okay, so uh, I cannot tell you that when the virus will not be in your body in every cases. I will say in general, in general, there we see is 14 days treatment and another 14 days quarantine. I would say 1 month. Usually, people are virus free, but in some cases with severe infection, the virus can be in your body for 1 to 2 months. It can be there, but it's not that you are going to
So,
be walking around. You will be in
yeah.
ICU, or you are very sick, something like that.
So it's
And
quite
about the
safe to
test,
meet people after 30 days, you mean?
yeah, 14 days in the hospital treatment, and another if you are uh, a red zone in the patient who have symptoms. I will say if you don't have symptoms, you are in home quarantine, home isolation, or community isolation. You are staying in Pasar Thai, we call a ศูนย์พักคอย or at home. If you are over there, you will get medicine, and you treat yourself, take care of yourself for 14 days, and you have to quarantine yourself another 14 days in the house before you go out. Okay, that is a safe timing. And what you was asking about, okay, about the test, we don't recommend you to do the test after 30 days, 40 days, because if you do the test after 3 months, it's still going to be positive, because
Okay.
the uh, I will say some part of the virus which is not infecting you is still be traced by the test. Okay,
Okay.
but you are not infected, but there is a trace of virus in your body that can be detected until 3 months of infection. So we don't
Okay.
do test after you are cured, until or unless you need a surgery or you need any further things to get treated in the hospital.
Doctor,
Hope
the
I
problem
understand.
right now is
Hope
that
I give you.
people are doing tests at home, and after
Yeah.
doing tests at home, they want to go to the hospital to do a swab test. Many hospitals are not accepting the patients to do a test. This is first.
Yep.
Second thing is, even if they get a swab test result, we cannot find hospitals or hospital beds for them. Where can we or who can we contact for this thing? Even if we can get some source that from the government or something where they can come and give the COVID medicines to the patients at home, and they can start treating themselves at home. What do you think, or how to go about this aspect?
Okay, so this system has been started. I think it's been a month already that Bangkok Metropolitan Administration, they are doing, Bangkok government, I will say, they are doing with the Thai government. They are doing, what they are doing is they have opened community isolation places เขาเรียกว่าศูนย์พักคอยในภาษาไทย you can search, and our hospital is taking care of around 7 ศูนย์พักคอย at this moment, and all the patients are being taken care of, the nurses and the doctors, but we are not going, it's not like we are going and treating patient over there. It's a ศูนย์พักคอย what it means is you have to get registered. First of all, you have to get tested first. Test, PCR test. When it's PCR positive, you go to ศูนย์พักคอย you go over there, and when you are in the system will they will screen you are in which color. Green color, I told you already, asymptomatic. Yellow color is some symptoms, and red color is symptoms to the lungs and patient who have low immunity. So when they screen that these patients are in green, so they are asked to stay at ศูนย์พักคอย or go back home to isolate at home, and they will get the medicine from the hospital. The hospital will send them the medicine. Okay, and if the patient are severe, they will send to different hospitals if the bed are available. I will say that if the bed are available. So we are trying our best to do that, to help the patients.
คุณหมอครับคุณหมอครับ ผมสามารถติดต่อศูนย์พักคอยได้ยังไงครับ Is there any number that you can give us that we can
I will give
contact?
you the numbers. I will give you the number, but not at this moment. I have a contacts.
No problem,ครับ. You can send it to me later.
The number is 1330 กด 15 okay 1668 and I understand that these numbers are burning. You are calling and nobody's picking up because there are so many cases. There are so many cases, and we are trying to help everyone at this moment. And this is I will say ปัญหาโลกแตก that around our hospital, I will not give the names, that many hospitals have stopped testing COVID-19 because they don't have beds, because they don't have places. But we are still doing. We are testing PCR. We are testing. We are accepting the patients. But it's overloaded at this moment. It's over our hands at this moment as well. But we are treating and try to identify, isolate patients and treat them. According to their symptoms. I will say that if green, you try to stay at home as home isolation, it's the best thing, or you go to the community isolation places like ศูนย์พักคอย over there. That is also it's a good thing there. Don't come to the hospital if you are asymptomatic or you have mild symptoms. I don't think any hospital have places for this group of patients anymore at this moment, in my opinion.
Understandable.
All right, thank you very much. Yeah, I think we have covered lots of questions, and we have crossed 45 minutes also. Now, if you have a quick, all three of you, not from the public, you have any question, please ask doctor, and doctor will wrap up final suggestion for the public. Yes.
Dan, you want to go first?
No, I just want to say thank you. I mean, to all the doctors, we understand it's more than us. You are there as a front line, and we just say "Khop Khun Kha" sincerely to all of you, to the medical team, to all the people who are there helping various embassies, and to the doctors, your families. I would say, they are there to encourage, and I'm sure they're also worried. So keep fighting, and to the people, we can help the doctors by staying home as much as possible. So let's try to stay home so we can help those who seriously need to be admitted. I mean, if you can treat yourself home first, try that, and if it's serious, then reach out to the hospitals. This is my request. Khop Khun Kha again.
Okay, Nikon.
For me, Doctor, thank you so much for coming. And Doctor, just as I'm going to pick your brain a little more before we end this session.
No problem. No problem.
If I feel that I have some pain in my throat or I'm not feeling very well, when should I go for a test?
Okay.
Because right now people are just panicking. But when should it be that, hey, now it's time to get tested or time to go to the hospital?
Okay, so it's a very good question. Like just now, I just got a call from someone I know. He says the same thing that you are saying. I have a sore throat. Should I go for a test right now or what? So you have to evaluate yourself first. Are you at risk at this moment or not? Okay. Did you meet somebody who had if you met someone who is infected and he called you, yeah, I am infected, then you are the first contact person. You need to go and get tested. Okay. And or your house or someone house who is the whole family is infected. If you are asymptomatic or have mild symptoms, my recommendation is you go for the test. It's a first contact. You need that. But if you don't have risk, like you haven't gone outside, you are sure that you are in the house and you're taking precautions and you don't have anything, but you are having sore throat, you can wait and see for 2-3 days. You can take paracetamol, you can take some medicine for sore throat, not antibiotics, and see how it goes. But if it's not improving and your condition is not improving, you can always go for the test. I'll say, usually what I say is I'll wait for 3 to 5 days and see how it goes. If it doesn't go well, then you need to go and get it tested, because sometimes you don't know that from where you got infection. Okay, but in my opinion, not just now and you go, it won't come. You might need a second swab after 7 days. Like if you feel today that you go, you might be negative, but after 7 days, if the symptoms are not improved, you need to re-swab again. Then it's a tough time for you, because every time you get swabbed, it's not fun.
A pleasant experience. Yeah, it's not a pleasant experience.
For a lot of patients, and I say it's not fun. It's not fun.
Okay, thank you very much, Doctor. On behalf of Indian Association of Thailand, I really salute you to all the COVID warriors. You are one of them. You give lots of informative knowledge to the public, those who are seeking, and even we too, even we are done. So that's why we said talk to expert, medical expert. So you are there. Salute. Thank you very much, and we'll see you in the next session whenever we are ready. Okay.
Okay.
Khop Khun Kap. Stay safe and God bless.
Thank you.